Welcome to the 2015 Perinatal Forum. It's the 19th consecutive year and the 9th to be titled the annual Dr. Brian Pridmore Perinatal Forum. So firstly, we'd like to acknowledge this land that we meet on today is the traditional lands for the Kaurna people and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. The edited version of this is placed on the SA Health website, as you can see. It's fairly easy to find, and we certainly encourage the use of this site and this function, and it does depend on the number of hits that are received. And so if you could please encourage people to have a look at the recording that's on the website, and certainly people who aren't able to attend or haven't been able to attend tonight, we certainly encourage that to be viewed at some point. So the committee would also like to acknowledge the contribution that Ms Julia Atts, a midwife from Burnside Hospital, that she's made to the subcommittee since 2004. Julia has now retired and decided that it's time for another person to take on her role. So thank you, Julia, and best wishes for your future. We would also like to commend Robin Canare and Dr Wendy Shield from the Pregnancy Outcome Unit for all the hard work they do in helping to bring all the components of these events together. Thank you. And a big thank you to Dr Brian Wheatley, who, as we know, has chaired this committee for some time and has finally convinced Morgan and myself to host this year. So thank you, Dr Wheatley. I don't know if I'll thank you for this part. So as a subcommittee of the main Maternal and Perinatal Mortality Committee, we're also requested to each year bring to your attention the latest recommendations that will appear in the most recent annual report. And so these were recommendations are from 2013, and we'll just go through those briefly. The first of these recommendations, and these are the provisional draft recommendations, talks about a root cause analysis, which is recommended to be conducted in all cases of direct maternal death and potentially indirect maternal death. That IV drug users, pregnant and non-pregnant, who have a febrile or inflammatory condition should be investigated for endocarditis. That fetal growth restriction associated with maternal hypertension should be recognised as preeclampsia and labour induced by 37 weeks gestation. And finally, to improve the rate of consent for autopsy, the first point is that experienced or senior staff should seek parental permission. And families should be informed of the value of a good quality autopsy in confirming antenatal diagnoses, eliciting other findings which are significant in determining the cause of death, alleviating parental guilt, helping with the grieving process and parental counselling, and understanding patterns of disease. So on to this year's forum. We've changed the format a little in that as we travel the journey of the mock case scenario, our invited expert will give a short presentation on their area of expertise. Following each presentation, there'll be an opportunity for you to ask questions of our experts, and we'd value as many as you like, really. One of the great strengths of these events over the years has been your participation, and it's sometimes very lively, as we know. So the experts we've invited tonight are Professor Kelton Tremelin, Ms Emma Angel, Dr Erin Clark, Professor Rob Bryce, Dr Chris Munt, and Ms Elizabeth Kleinig. So we look forward to hearing their talks shortly. Why have we chosen this as our topic this year? Oh, I think you'd be living under a rock if you haven't noticed all of the headlines that have been coming out in the last few years. Certainly a lot of celebrities are in the media, particularly very recently, with Michelle Bridges and her pregnancy and the controversy surrounding this. Looking at the statistics obtained through the Pregnancy Outcomes Unit, we know that the proportion of primiparous women with their first birth age greater than 35 years throughout South Australia has increased substantially, certainly over the last 25 years, or a bit over 25 years. So if we look at the graph, in 1986, 2.7% of primates were between 35 and 39 years, and that's compared now to 10.8%, which was its highest in 2006. In 1986, 0.2% were between 40 and 44 years of age, compared to 2.4% in 2013. And interestingly enough, in 1986 there were no primiparous women over 45 years of age, and 0.2% in 2012. And so whilst the numbers aren't high, they're certainly there. And now I'll hand over.
This is all the mock scenarios and cases, and just a brief presentation. So, Maria is a 45 years old woman. She's professor of history working for the University of Adelaide. She's nulliparous. She's married to Mark, 48 years old lawyer. He has 2 teenage children from previous relationship. Just general information, Maria's BMI is normal, 24. Had an open appendectomy at age of 5 with a ruptured appendix. Otherwise fit and healthy. She takes Elevate, our pregnancy multivitamin, has not have any non-allergy, drug allergy, non-smoker, doesn't really drink any alcohol. And the family history is that the both parents have essential hypertension onset in mid-50s. And her mother had preeclampsia with first pregnancy, required delivery around 36 weeks. So they have been trying for a pregnancy for the last 6 months. She has regular cycles every 28 days. They're lasting for 6 days, and she has really no real gynecological history of note. So some limited investigation has been done. Her GP has organized anti-Müllerian hormone, which is undetectable, it's very low. All other hormones like luteinizing hormone, follicular stimulating hormone, they are normal. Thyroid function tests and prolactin are normal range. She had a pelvic ultrasound, which basically was unremarkable. The anthrophoric count was 2, which is low. And Mark had a semen analysis, which was entirely normal. So I now want to invite the first speaker, Professor Kelton Tremolin. He is a fellow of the Royal Australian New Zealand College of Obstetricians and Gynecologists and a subspecialist in clinical reproductive endocrinology and infertility. He works as a clinician at Repromed and is a professor of reproductive medicine at Flinders University. He has a research interest in diminished ovarian reserve and has been working in that area for many years. And I'm delighted to invite him for a talk.